What is your worst? I looked away for 1 second story. It took only 2 seconds of me looking away from my son to give himself a life-threatening injury. I had just finished changing my 6-month-old son's diaper, with him lying on the couch, with a changing cloth underneath. I turned to throw the diaper in the trash right next to the couch, and in the 2 seconds I didn't have my hands on him, he rolled off the couch. He'd never even rolled over before. He hit the ottoman, which spun him back the other way, and he smacked his head on the hardwood floor. He cried, but calmed down after a few minutes. There was no sign of swelling, no blood, or any signs of damage. We were worried about a possible concussion, so we kept a close eye on him the rest of the day. When it was time for us to go to bed, we decided to stay up and watch a movie instead, and I went in and checked on him partway through the movie while my wife went to make some popcorn. I changed his diaper, and he woke up a little. One of his pupils was overdilated, and the side of his face had started to droop like he was having a stroke. We immediately grabbed our diaper bag, jumped in the car, and drove to the hospital, which fortunately was only 10 minutes away. I walked into the ER carrying my son and told the nurse that I thought he was having a stroke. She checked him, took us to a back room, and within minutes the room was swarming with medical personnel. A doctor informed us that it looked like our son had cracked his skull internally, and there was swelling in the brain. They would need to perform open cranial surgery immediately to relieve the pressure on the brain. The doctor told us that they weren't sure he would survive the surgery, but it was the best option. We were whisked into another room, separated, and asked questions about exactly how the injury had happened. They wanted to make sure it wasn't due to abuse, because they said that falling off the couch onto the floor shouldn't have had the force to crack an infant's skull. At this point, his mom and I were both sobbing, just trying to figure out what was going on and whether our son was going to be okay. When they finally finished interviewing us, they brought us into a waiting room. I called my parents to tell them what was happening, and then another doctor came to tell us that the surgery had gone well, but that they'd had to remove around 2/3 of his brain tissue due to the blood saturation damage. He showed us an X-ray or MRI they had done just before actually beginning cutting that showed what looked like a crescent moon of gray matter clinging to the left edge of the interior of the skull, with the rest of the image filled by blackness, which the doctor told us was blood. He advised us that even if he survived the rest of the night, our son would likely never learn to walk or talk. When the surgery was done, they brought him to us. He was still groggy from the anesthesia, but other than being fussy, he seemed otherwise like his normal self. Of course, there was also a large incision wound, stitches, and tubes coming out of his head to drain off the excess fluid. It was around 2 a.m. at this point, but I called our religious leader, who I was also good friends with, to tell him about the situation. He came and prayed with us, and offered a blessing for our son, just that he would make it through the night. He survived the night. He survived the next week, and the next month, and every time the doctors saw him, they said it was a miracle that he was alive. He had mild seizures for a few months after the operation, and when he first started to crawl, he would sometimes just stop and freeze for a second or two for no apparent reason, but remarkably, the remaining 1/3 of his brain matter that they left grew to fill the rest of his brain cavity. The blood vessels from the left side of his brain spread and grew all the way across to cover the right side where the original vessels had been destroyed. He learned to talk and walk within the regular timeframes, and has had no noticeable residual effects of his traumatic injury. When we took him back to the hospital 6 months later for his final post-op checkup, every one of the nurses said it was a miracle that he was even alive, much less talking and moving around like a normal 1-year-old.